About a confirmed death in Texas. Can you tell us more?
Yeah, I can confirm very sad news coming out of Texas that a child has died from the H1N1 virus. As a parent and a pediatrician, my heart goes out to the family. As I've been saying for the past few days, flu is a very serious infection, and each virus is unique, and so it's hard to know what we're going to be seeing. But given what we've seen in Mexico, we have expected that we would see more severe infections and we would see deaths. And we've confirmed the first death in this country in a 23-month-old child in Texas. All
right, so this is a toddler, 2 years old. Out of respect for the family, I'm not going to ask you any more about their specific case. But for parents listening, this strikes fear in your heart, of course. What should you do? Are you changing any of the recommendations for people if your child or if anyone around you seems to be sick with the flu?
You know, we're not changing our recommendations, and the recommendations that we've been given are the right ones to reduce the risk of you or your family members getting flu. They're important. They're important all year round, but especially now. Flu and respiratory infections tend to be spread through hands. So frequent hand washing. If you don't have soap and water, alcohol hand gels. If you're sick, cover your cough and your sneeze, not with your hands, but with your elbow or your shoulder. And if you have a fever and flu-like symptoms, don't leave the house. Stay home, give your doctor a call and see whether they want to see you in the office. If you're quite ill, then you need medical treatment.
Right.
Thankfully, the majority of cases we've seen so far have not gone on to the more severe form. But we have to watch for that, and we're looking very aggressively around the country for those cases and implementing control measures.
Right now we have 64 confirmed cases. There could be more. Apparently they're testing some kids at a school here in New York City to see if they were exposed and possibly infected. But what determines whether or not, I mean, we're hearing about this death today, whether or not it goes from just having, you know, a severe flu that knocks you down for a few days versus dying? I mean, should people be thinking about getting Tamiflu prescriptions, and what should people do?
You know, I would like to put this in perspective. Seasonal flu each year causes tens of thousands of deaths in this country, on average about 36,000 deaths. And so this flu virus in the United States, as we're looking at it, is not acting very differently from what we saw during the flu season. But we're continuing to look for cases, and as we look for cases, as state and local public health looks for cases, I expect we're going to see more cases. And as we do, we'll learn more about this. And if there need to be either more stringent or less stringent recommendations,
right,
we'll be making those.
Are you guys fast-tracking a vaccine for the swine flu?
Yeah, you know, whenever we have a new flu virus, one of the first things we do is begin building up what's called a seed stock of that virus, so that if we decide to make a vaccine, we're ready to do so. And that's what we're doing here. We're moving forward aggressively on that front, so that if the decision is made, we are ahead of the game on that.